So this next exercise has a number of different names and variations. Some call it pelvic tilt, pelvic tuck, hip tilt, hip hinge, hip lift, hip bridge, hip roll up. I'm going to start with the very basic, and that is the pelvic tilt. All we're doing is pressing the lower back to the floor by tilting the hip. So imagine the hip is nice and flat, and we tilt or we tuck the pelvis towards ourselves. That's the first stage. Create that space beneath the lower back, create that hollow by tilting the opposite direction. Flatten the lower back again by tilting towards ourselves. Sometimes some coaches would use the analogy of holding a cup of milk here, or a saucer of milk, or a bowl of water, or something like that, and that you're trying to tilt it towards yourself and away. Next stage then from there is you're going to imprint onto the ground, imprint that lower back onto the ground, and barely get the buttocks just about lifted. The buttocks and the back part of the pelvic bones are just about lifted here, clear of the mat, and control back down. The goal is that eventually you'll be peeling your spine away from the floor along the lines of this. So coming up slowly, vertebra by vertebra, until you're right up onto the shoulders. And sometimes your hamstring may cramp while you're doing this. If so, take the pressure out, just stretch the leg, come back into it when you're ready. So once again, we're going to get that pelvic tilt to imprint the lower back onto the floor, and we're going to continue then that lift, slowly rolling the spine up away from the floor. Always work with your own pain-free range of movement. If it's uncomfortable, that's okay, but it shouldn't be painful. And I'm slowly rolling back down, vertebra by vertebra. And keeping that pelvis tucked, keeping the tailbone tucked up, so that my lower back can touch down and imprint before my pelvis touches down, before my butt touches the mat. And once again, tuck that tailbone, imprint the lower back to the mat, and I'm slowly lifting away. Slow and steady is key in this movement. While you'll mainly feel this at the time in the back of the thigh, the hamstrings, in the backside, in the glutes, and in some of the core muscles around here, around the waist. Those aren't the main beneficiaries. The main muscles that will be benefiting from this are stabilizing muscles along the spine called multifidus. Slowly coming down, vertebra by vertebra, and then eventually imprinting the spine, imprinting the lower back, and relaxing that tilt. So that stabilizing muscle, multifidus, it has one job, and that job is to hold groups of vertebrae in place relative to each other. So take this as being your lumbar spine. It'll hold L1, L2, L3, L4 together relative to each other. So relative to the thoracic vertebrae above and the sacral vertebrae below. It'll hold them together in a group so that you don't have them sliding out away from each other. That's the role of multifidus. It's a postural muscle, it's a stabilizing muscle. It's not really involved in movement except to stabilize the spine.